A new warning coming out from the CDC that the United States is currently facing a new surge of COVID 19 infections once again as the summer is nearing an end. And they're saying that they're detecting this in the wastewater and that it is increasing in over half of the states in the US. And a new article coming out in just the last 24 hours. Listen to this. Summer COVID surge shows that we may need to return to 2020 pandemic measures restrictions. Let me know your thoughts in the comments down below. Do we need to go back to the pandemic restrictions that we had seen before? If you think we do, go ahead and put a 2. If you think no, we do not need these restrictions, go ahead and put a 1 in the comments. But again, these headlines coming out in just the last 24 hours, these warnings from the CDC that the United States is facing this surge of COVID-19 infections once again as the summer is reaching an end. They're detecting it high levels, very high levels in the wastewater. And like I said, headlines coming out saying that we may need to return to 2020 pandemic measures. This just coming out in the last 48 hours, as today is August 30th, 2024. And again, let me know your thoughts in the comments. If you think that we need to return to pandemic measures, put a 2. If you think no, we will not comply, as I see Patty saying, put a 1. Be curious to see what people think, but we're hearing that there is a new wave of this that is taking place, and I'm going to get you the latest details on that. Now, in addition to that, if you missed my videos recently, there has been a ton coming out. We saw Kamala Harris come out with her first interview last night. I shared with you just a little pre-clip that was released early. In addition to that, there's stuff starting to come out on Social Security. I will continue to keep you guys up to date on that as well. And now we're also hearing about the Mpox. We're hearing about the Triple E. We are also hearing about wars taking place. And now also COVID is surging to new levels. Unlike what we said we have seen since 2020, they are saying that it is starting to take off again. And let me know your thoughts. I've heard a lot of people saying they're hearing that people are getting sick once again with COVID-19, and they are actually having to be hospitalized. Once again, they're saying there's this new surge, this new wave. I'm going to share with you what they're saying here at the CDC, the Center for Disease Control and Prevention. They're saying that we made a few mistakes shutting things off and letting people go back to normal life a little bit early. So, man, let me know your thoughts, you guys. This is absolutely incredible. So I'm going to get you caught up on the latest. Now, do me a favor. I see we've got almost 1,000 people live with me today, this Friday evening. I'm going to get you caught up on this. Do me a favor before we dive in, take a quick second, hit the like button if you appreciate the updates, keeping you up to speed on everything, as literally 4 years later, we're hearing we might be back at the exact same point that we were before, with diseases spreading and potential measures going into place. Absolutely incredible. I think the vast majority of people are saying they've had enough of it, but there's a lot of people that are very concerned, saying that, no, we need to take precautionary measures because there are those that are immune compromised that want to see things set in place. So let me know your thoughts, you guys. We could be talking masks, various restrictions, things like that. Again, let me share with you the latest. And again, these articles are going to be linked in the description below. Both of these came out from The Hill. I'm going to reference these for you. They're linked down below. I cite all the sources like a book report, so that way you can see it for yourself and know it's the latest. And also, to stay up to date, don't forget to take a quick second and hit that subscribe button for me. It will keep you up to speed. It's totally free. And I actually just saw somebody in the comments say that they got unsubscribed from the channel and they're not doing it themselves. So again, if you're getting unsubscribed from the channel, we think that it is a YouTube's setting issue, that there was an update. Make sure you stay subscribed, check your settings, hit the subscribe button to stay up to date, turn on the notifications. And like I said, resources and articles linked down below so you know exactly what is going on. But let's go ahead and dive right in and get you caught up on the latest as to what they're saying, as they are saying, as I said, that the United States is currently facing a new surge in COVID-19 infections once again as the summer is nearing an end. And summer COVID surge, we may have to return to 2020 pandemic measures, this article says from The Hill, coming out in the last 48 hours. So let's go ahead and get right to it so that way you can hear the latest. And like I said, do me a favor. We've got 1,119 people. Please take a second, hit that like button, even though I know that This is not what the vast majority of us want to hear. If you appreciate the updates, please take a second and hit that like button. It helps spread this out further across the YouTube platform. Now, this article coming out from The Hill says the United States is facing a surge in COVID-19 infections once again as the summer season nears an end. The late summer spike has many Americans questioning how long the numbers will last, the signs and the symptoms to look out for, and when we can get an updated vaccine. Now, there's updates on vaccines coming out for this as well. Now, how bad is the COVID-19 summer surge? Well, as of August 16th, so about 2 weeks ago, the CDC, the Center for Disease Control Prevention, determined that COVID-19 infections, they were growing and likely will continue to grow in at least 27 states in the U.S. It also said that last week, it's wastewater monitoring, and I've shared this with you in the past. They check the wastewater to see how much COVID is in the wastewater. Wastewater monitoring for COVID-19 shows that levels are very high and have been on a general increase since the beginning of June. Doctors have suggested the recent spike in COVID-19 infections could be one of the largest summer waves that we have observed since the outbreak first started. So they're saying we can expect a massive wave of COVID-19 to be coming here very soon, very similar to what we saw when it all first began. So they are starting to prepare yourselves, and that is why articles are coming out saying we might need to put precautionary measures back in place. And again, put those ones and twos in. Let me know if you think we will not comply. Put a 1. If you think no, put the measures back in place. Put a 2 in those comments. Now, the CDC's wastewater tracker increased to 8.86% on August 17th, which the CDC categorized as very high, marking a large jump from early May when the rate was 1.35 or minimal. The peak rate was 9.56, which occurred back in July of 2022, which means we are almost back at peak rates. Emergency room visits and diagnosis, hospitalizations, and deaths, they have also increased since May, the CDC data has shown. Hospitalization rates for the week ending August 10th peaked at 4.6 per 100,000 people, up from a rate of 1.1 back in May. The rate dropped back down last week to 3.1 per the CDC. Now, between August 11th and the 17th, 2.5% of emergency room patients were diagnosed with COVID-19, according to the agency data. Now, the data collected by the federal agency is limited as hospitals are no longer required to report COVID-19 hospital admissions, hospital capacity, or hospital occupancy data to the federal government. Now, what are some of the symptoms of the new variant? Well, the new variant that is spreading, this is the most recent dominant variant, is the SARS-CoV-2, which is a part of a group that is sometimes called the flirt variant, which evolved from the Omicron variant. Now, according to the most recent data available, the dominant KP.3.1.1 strain accounted for 36.8% of the cases from August 8th to August 17th, while KP.3 accounted for 16.8%. and KP.2.3 for 14.4%. So they're saying these new flirt variants, they are extremely contagious. And this is what is spreading around with this new surge. Now, Otto Yang, Associated Chief of the Infectious Disease at UCLA and Professor of Medicine, told NPR earlier this month that the variants don't appear more deadly, but they are almost certainly extremely more contagious. So if you have something that's equally deadly, but is more contagious, you will see more severe illness and deaths coming here, Yang said. So they are preparing for this to be extremely contagious. And let me know in the comments, have you seen more people getting sick with COVID-19? Do you know somebody right now that is sick or maybe being hospitalized, that is dealing with COVID-19? If yes, put a 3. If no, you're like, I have not seen or heard of any COVID-19 cases around me lately, put a 4. I'd be curious to see what people say. But I know even at my own church right now, there's a lot of people that they're saying, stay home. If you're sick, we don't want to spread it in the church. People are catching COVID-19. The summer's coronavirus variants cause similar symptoms to past Omicron variants, primarily upper respiratory illness symptoms, including fever, chills, cough, runny nose, stuffiness, according to the Cedars-Sinai. And I'm seeing a mix. I'm seeing some people with 3s, and I'm seeing some people with 4s, saying that nobody around them right now is currently sick with the COVID-19. COVID-19 is likely not going away anytime soon. Even as the virus is no longer considered a pandemic, medical experts noted COVID is not gone. COVID is going to be around probably forever, and we are going to typically see 2 or 3 waves a year, said Ashish Shah, the dean of the Brown University School of Public Health, who stepped down as the White House coronavirus coordinator last year, told the Washington Post this month. Now, how can I get an update on the COVID vaccine? Well, the Food Drug Administration, or the FDA, approved an updated COVID vaccine from both Pfizer and Moderna just last week. They are targeted at the KP2 strain of COVID and were approved for people ages 12 and above. Emergency use authorization has been granted for 3 doses of the updated Pfizer COVID-19 vaccine or 2 doses of the Moderna vaccine to be administered to unvaccinated children ages between 6 months and 4 years old. Children in that age range who have previously been vaccinated can receive 1 or 2 doses of either of the updated vaccines. Now, let me know your thoughts. I know there's a lot of controversy around children getting vaccinated. Do you think that kids should be vaccinated? If you think yes, put a 6. If you think no, put a 7. Let me know your thoughts in the comments. Children 5 to 11, they can receive 1 dose of either the updated vaccine regardless of prior vaccination status. If they've previously been vaccinated, the FDA advises that they wait at least 2 months before getting an updated shot because who recently had COVID-19 may delay getting the vaccine for 3 months, the CDC relayed. Now, the new vaccines were expected to be available at major pharmacy chains, including Walgreens, CVS, and Rite Aid, as soon as this week, according to multiple reports. So they're saying that these ones, they're going to be available for you very soon. Vaccines.gov provides information on locations that carry the updated 2024 going into 2025 COVID vaccines and allows patients to schedule an appointment. So they're anticipating a major wave. They've just approved a new vaccine. They're saying it's going to be at various locations. You can check it out at vaccines.gov. And I know a lot of people are against the vaccines, but there's a lot of people that are for it. So like I said, if you want to get access to it, it's at vaccines.gov. This article is going to be linked in the description below. And it says, what about Labor Day weekend? What could this mean for the COVID-19 spread? It says the late summer surge comes amid the back to school season and Labor Day holiday, where heavy travel is expected. Elizabeth Hudson, regional chief of the infectious disease at Kaiser Permanente, Southern California, told the Los Angeles Times that masks should be worn when traveling in crowded areas. Let me know your thoughts, you guys. They're talking about masks again, especially for travel, as we had seen in the airports before. They're saying that it should be done in travel. This coming from the Kaiser Permanente, regional chief of infectious diseases in Southern California, Los Angeles. When you travel, if you're going to be in an indoor area with an awful lot of people, to really reduce your risk of becoming COVID positive, you really should be wearing a mask, she told the Times, adding that if you're on a plane, if you're in an airport, those are the times that you really want to make sure that you are wearing a mask. Now, let me know your thoughts on this, because this is just a little bit confusing. I just want to take some time to dissect this just a little bit here with the information that we now have in 2024. Let me know your thoughts on this. She just said, when you are traveling, if you're going to be in an indoor area with an awful lot of people, to reduce your risk of becoming COVID-19 positive, you should be wearing a mask. Now, it was my understanding that the masks, they did not stop you from getting COVID-19. What the masks stopped was your air going out. So if you were sick, you should be wearing a mask to help stop your air particles from spreading around. So if you're wearing a mask, that's you stopping your spread, but it's not stopping others from spreading. So she is saying that to stop you from getting it, you should wear a mask. So to me, this statement makes no sense. Just my observation from what I understand is that the masks simply stop your air particles from spreading. It doesn't stop others from spreading it to you. So this is your contribution to society by you wearing a mask. So this literally contradicts what we've been hearing, for the past several years now about the masks. So this is very confusing to me that Elizabeth Hudson, the regional chief of infectious disease at Kaiser Permanente, made this statement. Let me know your thoughts. Now, if it makes sense to you, you know what number are we on now? Put a 8. But if you agree with me that this statement actually doesn't make sense from what we've been told, put a 9, because to me it sounds like it doesn't make a whole lot of sense. And I've actually seen some memes on it where people were just, kind of in jest making fun, and they were saying it's like if someone wet their pants, it stops the spray from going out, and they only wet themselves. That's like what they're saying a mask is doing. But if other people aren't wearing and they're spraying everywhere, well, then that's going to get all over you, but it just stops you from spreading. And that was the humorous example that I had seen, was people going to the restroom wearing pants and stuff like that. So to me, this statement that she's saying literally makes no sense. That if you wear a mask, you will protect yourself from getting sick from others. No, that's not what we've been told at all. So this statement, I got to bust them out on this one. Doesn't make much sense to me. And I see all the 9s coming in, people saying that they agree. That's exactly what we've heard. So the flip-flop information is can be very frustrating sometimes. Now, listen to this. In regards to reinstating measures, here's another one that came out from the Hill in the last 24 hours that says summer COVID-19 surge is showing that we may need to return to 2020 pandemic measures. Now, this article says that as summer 2024 draws to a close, the U.S. finds itself once again grappling with the surge in COVID-19 infections. This wave has taken many people by surprise, particularly as the country has largely consigned that the pandemic is a thing of the past. While public life has pretty much returned to pre-pandemic norms, something almost none of us would have believed in summer of 2020, the virus itself has not subsided. Now, mutations of the virus continue to occur, and new variants are emerging, posing ongoing challenges to public health and safety. As we look ahead to the remainder of 2024 and into early 2025, as the new year is approaching, we need to take stock of where we are, understand the factors driving this resurgence, and better anticipate how the pandemic might evolve. Now, the recent surge in 2019 cases has disrupted summer travel plans, overwhelmed healthcare facilities in certain areas, and left many Americans dealing with the familiar symptoms of fever, cough, and fatigue. The summer months, typically associated with lower respiratory virus activity, they have instead seen a significant uptick in COVID-19 infections. Several factors contribute to this unexpected surge. One factor is the high transmissibility of these new variants, which I just read for you in the previous article, the flirt variants, which they're saying are extremely contagious. The virus has continued to mutate, with certain variants displaying enhanced ability to spread, even among populations with high vaccinated individuals. While vaccines remain effective at preventing severe disease and death, breakthrough infections are becoming more common, especially as immunity from earlier vaccines is now waning. Second, the wider spread relaxation of public health measures has created an environment conducive for transmissions. Mask mandates, social distancing guidelines, and restrictions on large gatherings, they have all disappeared. This return to normalcy, while massively psychologically and economically beneficial, has provided the virus with ample opportunities to begin to spread. Finally, the pervasive sense of pandemic fatigue has led to a serious decline in vigilance. Many people, weary of the pandemic's disruptions to their lives, they have become markedly less cautious. This complacency, coupled with the underestimation of the virus's ability to adapt, has allowed COVID-19 to regain a foothold on society. Man, let me know your thoughts in the comments down below, you guys. Wow, they are saying that we let go of the restrictions and therefore COVID-19 is surging back. But let me know your thoughts to go back to restrictions 4 years later. And they're saying that this is never going to leave. Are we going to be able to crush this? It just sounds like it's going to become kind of like the Spanish flu, which never went away. And now it's our regular reoccurring flu that has become less deadly, more contagious. That's basically what I understand COVID-19 is going to turn into. However, they're talking about maybe reinstating some of these measures to make sure that we can get a handle on this. But I've seen so many people say we will not comply. That number 1 in the comments, but a lot of people also saying we need it back, putting that 2 in the comments. But here they are making the case. This article, again, just to clarify, this coming out in the last 48 hours, you guys, this coming out August 28th and being updated just a little while ago. Today's August the 30th, 2024. This was not years ago. This is happening right now, where they're talking about this resurgence and potentially bringing back measures. Absolutely incredible. I saw all the ones coming in. I just don't know that people are going to follow these or adhere to it if they request this again. But we will see. Let me know your thoughts in the comments. Now, the federal government's response to the latest surge has been tepid at best. After years of intense focus on COVID-19, there is a palpable desire in Washington to just move on. This has resulted in a fragmented approach, with responsibility for managing the current wave largely devolving to state and local governments. While some have reinstated certain precautions, others have continued with business as usual, leading to inconsistent messaging and outcomes across the United States. Moreover, the federal government's decision to end the public health emergency earlier this year has had unintended consequences. The end of the emergency declaration led to the reduction in federal funding for testing, contract tracing, and vaccination efforts, just as these tools are once again needed. The lack of the coordinated national strategy has hampered efforts to control the surge and has left healthcare providers scrambling to manage increased caseloads with fewer resources. Now, looking ahead, the trajectory of the pandemic remains uncertain, but there are several key trends and scenarios to consider. The virus is likely to continue mutating, with new variants emerging that could potentially evade immunity from previous infections or vaccinations. This means that COVID-19 will remain a moving target, requiring ongoing surveillance and adaptation of public health strategies. The development of the updated vaccines and treatments will be critical in staying ahead of the virus, but the speed at which these can be rolled out will determine their effectiveness. We can and should also expect periodic surges of COVID-19 cases, particularly in the fall and winter months, when respiratory viruses typically begin to thrive. These surges may not reach the levels seen during the height of the pandemic, but they could still cause significant disruptions, particularly in areas with low vaccination rates or limited healthcare capacity. Localized outbreaks driven by specific variants or superspreader events will likely become regular features of societal landscape. Man, let me know your thoughts in the comments, you guys. This article really laying it down heavy, saying that we need to bring back some controlled measures. LC, thank you for your generosity. That $20 super chat says thanks with a heart. Thank you very much. I appreciate the support a ton. That is awesome. I will continue to keep you up to date on whatever unfolds. Make sure you know exactly what is going on. Now, the healthcare system, already strained from years of dealing with pandemic, is also going to face additional pressure if the current surge continues into the fall and into the winter. Hospitals and clinics will need to balance the demand of COVID-19 patients with the resumption of regular medical care that had been postponed during the pandemic in the early phases. This balancing act could lead to an increased wait time, resource shortages, and burnout among healthcare workers as well. Man, they are saying that we could be going back to what we saw in the beginning. And like I shared with you, the projections are that we could see the largest wave we have seen since the pandemic first started. And we can't underestimate how public fatigue with COVID-19 precautions will grow, making it difficult to reimpose restrictions and encourage preventative behaviors. This resistance could be particularly strong in regions that have experienced relatively low case numbers or where political leaders have downplayed the severity of the virus. Overcoming this fatigue will require clear and consistent communication from public health officials, as well as community-level engagement to reinforce the importance of ongoing vigilance. We are also making a big mistake if we ignore the economic and social implications continued with COVID-19. Man, that's a great point right there. How many businesses were destroyed from lockdowns? How many people lost jobs and businesses were just absolutely disrupted as a result of people not being able to go to work? There was so much that unfolded. The virus's persistence may lead to renewed disruptions in the travel industry, supply chains, workforce participation. Along with this, the psychological toll of the prolonged pandemic with the associated uncertainty and anxiety could have lasting effects on mental health and social cohesion. Policymakers will need to address these challenges proactively with a focus on the resilience and support for the affected populations. Man, that is an excellent point to remember. What is this going to be doing to our U.S. economy if we begin to put restriction measures in place yet again? Let me know your thoughts. Ugly Bear 90, I see you. Man, thank you for the $20 super chat. Your generosity is appreciated. I will continue to keep you up to date. Thank you so much for the support. Really means a lot to me and my family. So where do you realistically go from here? Given that it is clear that COVID-19 is far from over, while much progress has been made in terms of vaccinations and treatments, the current surge is a stark reminder that complacency is not an option. The road ahead will require a renewed commitment to public health, both from the government leaders and from individuals. So this particular article coming out from the Hill, they are saying that they are for moving forward with restriction measures yet again. And again, you guys, this is coming out just in the past 48 hours. We all need to prepare for not only the possibility of continued disruptions, but for another new normal that might be a little closer to what we saw back in 2020 than how we are currently living. Wow, man, let me read this for you again. We all need to prepare for not only the possibility of continued disruptions, but for another new normal that might be closer to what we saw back in 2020 than what we are currently living in right now. These new restrictions, that means preparing for future waves and the long-term implications of the world in which COVID-19 remains a persistent, if manageable, threat. But let me ask you this: how long are we going to be locked down? How long are we going to have these measures set in place? How long are you going to make people wear masks and do social distancing? I don't know. I'm asking the question. How long is okay? And what if society just does not accept it anymore? I already saw all of the people putting in the ones in the comments saying, we will not comply. We're not going to do it anymore. We're tired of it. And I saw a couple of twos, and I understand that there's a lot of people that are, immune compromised. They have, serious illnesses and things like that. They want to take additional precautions. But how long are you going to suppress society with these restrictions? Let me know your thoughts. Now, also, in addition to that, we had mentioned that there are new vaccines coming out. They're saying there's a new wave. They detected way higher levels that have been coming out. So we will see. And again, these articles are linked in the description below if you'd like to get hyperlinks to them. If you want to go to vaccines.gov to find out where you can get the latest vaccine, they have also made that available on these articles as well, if you're interested. But like I said, let me know, how long do you think is the appropriate time to address something that has been persistently been plaguing the United States, or the world actually, a pandemic? How long is the right time to put in place control measures? How long should it be for? Should it be for 6 months, a year? Originally, I think we had heard it was going to be like a couple weeks, 40 days back in March 2020. And in some places, it went on for an incredibly long time. And now they're talking about bringing it back. How long are we going to do this for? How long is the right time? I'm seeing Cat Scratch put a lifetime of restrictions. I'm seeing somebody else put, we will not comply. I see somebody saying, right. I think that they're agreeing with me, like, right. Ask this question. How long are you going to do it for? You can't just say indefinitely, we want you just to shut down and do all these things. And even this article makes the statement, makes the argument, what are going to be the repercussions that we're going to see unfold upon our economy, on our society, our mental health? These are really questions that we need to ask because this article is saying that the CDC is currently saying that there is a major uptick in COVID-19 cases. They're detecting it in the wastewater. They're seeing it, and they're saying that over half of the United States right now, states across our continent, are seeing upticks. And they're saying in order for us to get control of this, to get ahead of it, because we might see the biggest wave we've seen since the launch of the pandemic, we might want to take into consideration additional precautionary measures like we had when we first started. And I'm seeing a lot of people saying, we're not going to go for it. We're not going to go for it. Man, let me know your thoughts in the comments down below, as almost, 4 years later, we're seeing the same thing happening over again, and it's pretty incredible. So we will see. I see Mark Cooper saying, Steve, what do you think? Give us your opinion. Well, here on the channel, I like to give you guys just the facts, and you get to take them and do with them what you want. We have people across the board, Republican, Democrat, that both come on here for the latest news and updates. But I got to tell you, in my personal opinion, my opinion is I don't see people complying, and I don't know that we should be. I don't honestly feel like we should be restricting people. I feel like if you want to do it yourself, to take precautionary measures for you and your family, I feel like you should do so. You should have the right and the freedom to do that, but we should not suppress the rights of people that don't want to do that. You know, if somebody wants to walk around, you know, and do whatever they want, then go for it. But if you don't want to, if you want to comply or you don't, I think that you should have the freedom to do so. And also, like for the masks, like I mentioned, the masks do not protect you from other people. They protect other people from you if your air particles are not being spread. So to me, that makes common sense. And again, we are seeing somebody here that is a regional leader in health for California, in Southern California, in Los Angeles, saying, if you don't want to get sick, wear a mask, literally going against what we've been saying. So to me, it just seems like confusion. I would think that we would have enough information and details on the COVID-19 cases so far to know that for a statement like that to be made, to me, just seems silly. So that's just my personal take on it. I might be wrong. So, yeah. And thank you for your opinion. Mark says you are very welcome. Take off your hat, he says. I don't know. You guys want me to take off my hat? Let me know. If you want to see me take off my hat, say yes. If you think no, put no. My hair transplant operation will not be in full bloom until around Thanksgiving. So it's not quite there yet, but it's looking a lot better than it was. I'm seeing some yeses. I'm seeing some nos. Let's see here. It's a split. Take responsibility for your health. Somebody says, yes, I agree. People are saying no, yes. Yeah, I need to water it. Yeah, I got to keep it watering. I've got all these procedures and everything that I've been doing. The hairline, though, is looking much better than it was. A lot of you guys know I was balding significantly. Then back in April, I flew out to Istanbul, had the hair transplant done. Planning to do a video on it so that way you guys can see it, but I'm just really waiting for it to be in full growth. Kay says they want to humiliate you. Don't do it. I won't be humiliated. I'll go ahead and share my head for you guys. If you guys have lasted this long, just do me a favor. If you appreciate it, just take a quick second, hit the like button. I just need 60 more likes to get to 1,000. That would be awesome. I see we've got 1,500 people on live for the update with what's going on. So here it is. You can see my hair where it's currently at. You can see the new hairline, and you can see it's just not quite as thick and grown out right here yet, but it will be there pretty soon. But before, it was way back. It was going back quite a bit. So it's getting there, but it doesn't look like it's fully grown in yet. I think they said only maybe 15 or 20% of the hair follicles have grown, but hopefully it'll be 100% by Thanksgiving. So when it's there, I'll be able to show you guys the full bloom, all the sprouts. I see people saying it looks great. Awesome. Thank you. I appreciate that. I hope it comes out good. I flew halfway across the world to go get it done. Yeah, I feel pretty good about it so far. It's just definitely not fully, all the hairs follicles have not come out yet, but they said they should by Thanksgiving. So yeah, yes, why Turkey? Somebody said because Istanbul, Turkey. And like I said, I'll do a video on it. I'll give you guys all the recommendations and the links here. I've already discussed it with them. I tried to find the best place. They're the best in the world. They've got way better resources, doctors, facilities specifically for that. It's the safest, the best follow-up. It's got a lifetime guarantee, all of this stuff. And they get the best results and the best prices because of their economy over there. Man, it is incredible. The prices are way better and the quality is way better. So it's a no-brainer. Listen, if you or somebody you know is thinking about getting a hair transplant, do not do it in the United States unless you really want to do it here or wherever you're at. highly, highly recommend going to Istanbul, Turkey. And like I said, if you want a recommendation, I'm going to do a video on it soon, or reach out to me on Instagram at SteveRam3. I'll let you know my experience and what you can do, because I try to get the highest quality one. I took my whole family. We went for 2 weeks. We went sightseeing, had a personal guide help us. We did all this stuff, plane tickets, hotels, all that stuff. And it was still cheaper than had I done the operation here in the United States. So it's way more affordable. And it was one of the best clinics in the world. So like I said, if you guys want that done, or somebody you know wants it done, have them reach out to me on Instagram, SteveRam3, and I'm going to release a video with all the details soon. But I appreciate you guys remembering that I got my hair done. I will keep you guys up to date on it. And also, like I said, this update on the COVID-19 new surge coming out, these articles linked down below. I'll keep you guys up to date on everything. So that is the latest, you guys. Thank you so much for joining me. I hope that you guys have a blessed evening, have a blessed weekend, a blessed Labor Day. I will catch you in the next one. Don't forget, hit that like button, subscribe to stay up to date, and I'll see you guys later. Take care. God bless. This is Steve.